day everyone, this is Haber Ilapisaurus, and today I'm going to discuss one of the diseases that is caused by microorganisms. So this is specifically known as the syphilis. So I found this quite interesting and unique because we will learn a lot of things about what or how can it be acquired and what are the proper way or what are the proper ways of how to prevent this kind of certain disease or illness. So syphilis. So, syphilis is a sexually transmitted infection or STI, meaning to say it can be acquired through sexual contact with your partner that has a syphilis symptoms. So, what are the symptoms of syphilis? So, doctor categorized the stage of syphilis as either primary, secondary, latent, or tertiary. A variety of symptoms can define each stage. So, the disease can be contagious during the primary and secondary stages and occasionally the early and latent phase. Tertiary syphilis is not contagious but it has the most severe symptoms. So going on to the primary symptoms, the symptoms of primary syphilis include one or more painless, firm, and round cephalic sores or chancres. These appear 10 to 30 days or months after the bacteria enter the body or enter your body. So, chancres, it is the source or appears at the spot where the bacteria entered your body. Some people develop several of them. It resolves within 2 to 6 weeks. However, without treatment, the disease may remain in the body and will progress to the next phase. So that is the secondary phase. So what are the symptoms during in the secondary phase? So secondary syphilis symptoms include sores that resemble oral, anal, and genital warts. A non-itchy rough, red or red-brown rash that starts on the trunk and spreads to the entire body, and including to the palms and the soles. However, there are still symptoms includes muscle aches, fever, sore throat, swollen lymph nodes, patchy hair loss, headaches, unexplained weight loss, and fatigue. Without treatment, secondary syphilis can progress to latent and tertiary stages, which is the most severe stages of syphilis. So in the latent syphilis, the latent phase can last for several years. During this time, the body will harbor this disease without symptoms. However, the T. pallidum bacteria remain dominant in the body and there is always a risk of recurrence. Tertiary syphilis or late syphilis. So it can occur 10 to 30 years after the onset of the infection. Usually a period of latency during within there are no symptoms. So at this stage, syphilis damage the following organs and systems. So what are these organs? First is heart, blood vessels, liver, bones, and the joints. So what are the causes of syphilis? So the cause of syphilis is a bacterium called Treponema pallidum. So the most common route of transmission is through contact with an infected sore during sexual activity. The bacteria enter your body through minor cuts or abrasions in your skin or mucous membranes. Syphilis doesn't recur on its own. However, you can become reinfected if you have contact with someone's syphilis sore. So let's move into the next. What are the epidemiology of this kind of disease? Syphilis is a bacteria infection caused by sexual contact and is believed to have infected 12 million people in 1999 and with greater of 90% of cases in the developing world. It affects between 700,000 and 1.6 million pregnancies a year. This is attributed to unsafe sexual practices. So what are the prevention or what are the proper way of preventing syphilis? So practicing safe sex is best way to prevent syphilis infection. So what are these practicing of safe sex? So this includes we need to use always condoms with water-based lubricant during sex. Always use dental dams for oral sex, and then limit the number of people you have sex with, or just have sex with one partner who isn't have already infected. Avoid sex with someone infected with syphilis or who has symptoms of syphilis until they have finished treatment. And you need to have regular checkup of STI or sexually transmitted infection. So what are the treatment of this kind of disease? So there are no home remedies over-the-counter drugs that will cure syphilis. But syphilis is easy to cure in its early stage. And I repeat, syphilis is easy to cure in its early stage. A single intramuscular injection of long-acting benzathine penicillin G will cure a person who has primarily or secondarily or early latent syphilis. Treatment will kill the syphilis bacterium and prevent further damage, but it will not repair damage if already done. Selection of the appropriate penicillin preparation is important to primarily treat and cure syphilis. Thank you for listening and good day, everyone.